Okay, we're going to learn to create a new event or case in WDRS and take it through the first few steps of that. When you first get the fax report of a new communicable disease, you're going to first try to make sure it's not been started by someone else in your jurisdiction. We're going to go through the search button here. I'm going to click on that. We're looking at a new case of we're going to say this is pertussis. So I can go there, and person's last name is Smith. So it's a common name. Well, we have to put the wildcard there. So let's see if we've got that in there. I'm going to go down to the bottom, hit the search button. I have a Dylan Smith who was reported for pertussis. But the case that I got reported to me is a Patrick Smith. So I know it's not been already entered into the system with WDRS. So now I'm going to close that, and I'm going to go to the Create Event button. And I'm going to get this screen here, and it's important to put as much information here as you can. So we're going to put this as a pertussis. Let's find that. We've got a Patrick Smith, date of birth 12/15/1999, male at birth, no alternate names. I'm not going to put a phone number yet, but I will put an address because this is important. East 31st. Okay, it's going to ask to validate that address. I'm going to view that. Looks good. I'm going to use the validated address there. It's in Spokane County. It's going to fill in some of those additional fields. Residence type is a private residence. And now I'm going to create that case. So now I come to the event summary for that case. And so there's a couple things that we need to be doing. I'm going to start off by going into a couple of these question packages so you can see how that information is broken down. So here in the administrative question package, we'll double click on that. It has a number of things that we can put in there. I'm going to put in an investigator right here. I'm going to put myself in. So I'm going to just search for myself. I'm Springer. I'm in there. Double click that. I'm going to be assigned there. So there are a number of fields that are grayed out, like these right in here. Hard to see. Those are not editable at this point in time, so they could be editable later on depending on what other fields we fill out. I'm going to hit the save, which is going to take me back to the event summary. If I hit save and stay, it's going to save that information but still stay on this page. But I don't need anything else there. What we're going to do is we're going to start with the wizard. And this is most similar to what we would see with FIMS and kind of mirrors what we see on the paper form. This is probably the easiest way to make sure all the information that you're getting is easy to put in the right spot. And if you're conducting an interview on the phone while you're doing data entry, this is certainly the best place to be. So let's click on that. We've got, again, some things that are grayed out, that we can't put in yet. So accountable county is not listed here, and that's really important that we make sure that our county is the accountable county. So I'm going to select reporting address. I'm going to select this address as the official address. Maybe they have several addresses because they're in split family. Now Spokane County becomes the accountable county, and it becomes one of our cases. So you see a few other things here. Notification date. I'm going to put 3/8/2018, and investigations 3/09/2018. if we hit save and stay, some of these other fields may become open. Right now we don't have a case classification that we can select that's grayed out. We can put in some race or ethnicity data, some other information on the healthcare provider. You're going to see information here on some of the risk factors. So cough lasting at least 2 weeks. If I put yes here, it's going to fill that in. There are some other questions that if we put an answer in, it's going to open up more options for us. So, does the case know anyone else with similar symptoms? I'm going to say yes. And now it gives me a way to describe that. Epi linked to a laboratory confirmed case, yes. I'm going to hit save and stay. So we can put, fill some of that information out. Try to look at some other options where that's individual international travel related. I'm going to say during part of the exposure period, and put a few other things in there that might lead to some additional questions. Prophylaxis of contacts recommended. Now I have more information that I have to fill out based on that answer. If I would hit no, I wouldn't have had those choices. So what I want you to think about as you're going through there, as you answer questions, more detailed questions may come about with that. So I'm going to hit save and stay and see if that lists any flags. So I'm going to go right back to the event summary. So we've went through the wizard a little bit and put in some information there. You can see at times, if I click on the question package, that some of those things out of the wizard will show up in here as well. So that's another way that you can get to that. So this is a way that you can kind of see the basics of entering in a case. And just a quick summary to kind of clarify this, we want to put as much in this initial patient screen that we do when we create an event, we want to put as much information here as possible, especially the address information, because that means that when we do go to the wizard, I'm going to hit save. When we do go to the wizard, that's going to allow us to choose our county as the accountable county. That's really important for that to be one of our cases and for other people in our LHJ to be able to view that. Then the next step is to go into the wizard. And I'm going to look at event data there. I'm going to choose the wizard and start entering in my information for my paper form. Or if I'm going to call the patient up, this will be what I'll have open on my screen as I conduct the interview. So that's the basics of starting a patient in WDRS.